front of us here, we're just talking a little bit off the air about how do I say this? How do I introduce you? You got so many letters after your names, the both of you. But basically, Dr. Patrick Mularoni, medical director, sports medicine program here.
That's correct.
Okay, I'm so far so
You
good.
got it. You got it.
So far
Ryan.
so good. All right, and then Dr. Jennifer Katzenstein, clinical director, pediatric neuropsychology. Did we do it? Okay. Oof. And I'm just going to go with Dr. Patrick, Dr. Jennifer.
Sounds perfect.
But before we were getting ready here, Dr. Patrick, I want to share your comment with everybody. I love that. You said, if you Google me, all the pictures that show up are me doing the Radiothon interviews, which is, hey, that's awesome. I love that.
Well, this is a great event, and we appreciate you guys being here every year for us. And I guess it speaks to that. For many Google hits is all the years you guys have been here, so I appreciate it.
Well, thank you so much for stopping in and chatting with us a little bit. We're kind of focusing, kind of talking here next few minutes about concussions. And you're the medical director of the sports medicine program and dealing with concussions. Now, maybe when people are listening, maybe they don't incorporate that with all children's, or they don't, they're thinking, major diseases or something. But kind of tell us about, your side of things here.
Well, at Johns Hopkins All Children's Hospital, obviously we take care of children that require inpatient care, but we take care of a lot of outpatient children as well. And one of the areas that we saw a need, especially in the last 5 years, was taking care of children with concussion. And as we know, concussion has kind of become a real hot topic in the media, and we're recognizing concussion a lot more. And with the way that kids are functioning in schools and in sports now, especially with all the iPads and all the smart boards and the visual stuff that goes on, there's just a lot more cognitive stress on them. There's a lot more stress on their brains, and these kids suffer more with concussions. So one of the things that we do, we have 7 outreach centers where we see individuals who get concussions from sports and care for them, not only trying to get them back to sport, but trying to get them to function in school.
And as I was flipping through the notes here, this is maybe, I don't know if it would surprise anybody else or if it's just maybe Ryan the dum-dum, but watching football or something on TV, and you see somebody and they go, oh boy, he looks wobbly and maybe has a concussion. I didn't know that concussion isn't something that shows up on an MRI or a CAT scan. That was kind of always my thought. Oh boy, he got hurt. The next day you read it in the paper. Yep, he's going to be out for a week with a concussion. I just figured they took the test. And so,
Right.
So how is it that how if somebody has a concussion, how do they walk in? What are the symptoms, or what do they go through before that's kind of the diagnosis?
Well, I think that's something important for the listeners, to know that most people think you have to lose consciousness to have concussion, and that's just simply not the case. Less than 5% of children with concussion lose consciousness. The other 95% suffer a hit to the head or the body, and they'll complain of some symptom, typically immediately, and usually headaches, but sometimes they'll have dizziness, sometimes they'll have emotional changes or problems with vision, and they just need to be watched really closely to pick those things up. The fact that you said that you can't pick it up on CT scan or MRI, it takes a clinician who's comfortable managing this to recognize it and then work through it with the family.
But it also is kind of a thing. If it's serious enough, is that you can spot it right away? Like if you're
most parents pick up on it because their child's just not acting right. And then especially when they try and go back to sport or go back to school, that stress on the brain is going to cause them to have headaches and other symptoms. They're going to get worse when they're at school and in those functions.
Okay, because like I said, my kind of knowledge of it is watching TV and 2 days later going, yep, I had a concussion. As far as it goes with kids, they're coming in with could be sports injuries, could be something else. But after they do, and the concussion is, you realize that's the case. What happens to treat a patient with a concussion?
Well, I think one of the most important things is getting the student athlete back into school. Dr. Katzenstein works closely with our group to help identify the problems that might be going on with school. And go ahead.
Well, for the most part, we'd expect a child to be able to return to school in 7 to 10 days without difficulty. There are some kids who have more difficulties returning to school with concentration, fatigue, sluggish cognitive tempo, not being able to problem solve as quickly as they could before. And Dr. Mulroney mentioned something really important, the smart boards and the electronics. And so the exposure to screen time, not just our daily fun looking at our iPhones, but then also the needs for education play an additional role in the brain having more difficulty healing over time, and we want to slowly return them to school. For some kids with additional difficulties, maybe pre-existing learning differences or ADHD, we want to be even more cognizant of that and make sure the school is set up for success.
And it's an epidemic. You kind of mentioned, it's in the papers. They did a movie about it. but it's one of those. It's an injury that's like it seems like the numbers are they're going up. Correct?
Well, yeah, we're diagnosing it more often. And I was just in clinic a few minutes ago talking with a dad, and I said to him, he's a former athlete, former military, and I said, you and I have probably had concussions we don't know about.
Didn't know about it.
But the world is a different place now. We didn't have smartphones. We didn't stare at iPads like these kids are now. We weren't on virtual reality. And it's those things. If you were gonna create something to make concussion symptoms worse, you'd have somebody stare at an iPad or play a first-person video game. And I think that's the most important thing for parents is if you're questioning whether your child has a concussion, first thing is when in doubt, sit them out. Do not let them back in the game because getting hit again on a concussed brain could hurt you even worse. And then the second thing is we need you to just turn off all technology. So they need to go away from televisions. They need to go away from smart boards, iPads, video games. And unfortunately, like this little young man I just saw, he looked at it like it was a punishment, like I was punishing him. But the truth is I'm trying to help him so that he can get back into school, can get back into sport, and function without headaches and these other symptoms.
Well, yeah, I can't imagine you're going to be anybody's BFF if you're taking away their iPad. I mean, come on. When parents come in and you diagnose and you say, we're looking at concussion, how often, maybe is there a number you can just throw out there? Like, how often is it surprising to them, maybe?
I don't think it is surprising. I think the media has done a great job, and we now know that concussion's out there, and because it's so prevalent and happens so often, parents know about it. Parents diagnose it, at home, and anyone can diagnose a concussion. The coach can diagnose it. The parent, somebody at the sidelines, just recognizes that something's going on with the child. So most of the families that come into my clinics already know that something's going on. And nowadays, a lot of the high school students will say, I had a child just last week that said to me, I was playing basketball, I got hit in the head, and I went and sat on the bench because I knew I had a concussion. And I said, whoa, have you ever had a concussion before? He says, no, but I had heard about it.
So the kind of the thing would be if you have any sort of trauma or something and you realize something is off or behavior isn't normal, then go get it checked out by all means.
Absolutely. And one of the things that's so nice about our relationship with Johns Hopkins here at All Children's Hospital is we're not only clinically taking care of children, but we're doing things to try and move the needle forward with regards to, taking care of the whole country, taking care of the world. And some of that is through research. Right now, Dr. Katzenstein and I are doing research projects regarding concussion. Why don't you go ahead and talk about a couple of them?
Well, it was the perfect timing because we just have a paper that we're putting together on concussion and knowledge in players, parents, and coaches in ice hockey. And what we're finding is parents, players, and coaches actually have a very good idea of what concussion symptoms look like. They know when to refer out to a different provider and how to go about that. But the trouble is in the treatment and how to move forward. So they're still struggling with how to return to play, how to return to school, and how to make those decisions best for our students. That's one of our more recent studies. We have an additional longitudinal study that Dr. Mularoni can talk about.
Yeah, and we're trying to look at, one of the things I tell parents is, look, we're learning so much. There's hundreds of papers that are coming out each month about concussion. So I'm an expert on concussion, but if I walk in the room in 10 years and look at myself sitting in the chair, I'll say that guy doesn't really know very much because we're learning so much every day. But one of the studies that we're doing right now is we're working with high school football players, hockey players, and soccer players, female soccer players, and we're looking at head movements with sensors to see how many hits they're taking in a game. We're checking them. Dr. Katzenstein is doing neuropsychologic tests before and after the season to see if there's any changes in function. And then we're taking biospecimens. So that's one of the exciting things is that the future, I think, of concussion management is finding markers in the blood or the urine or the saliva that maybe we could do tests on the side of the field so that if somebody gets pulled out, you could check a marker inside their blood and know if that's elevated, then they should be evaluated further. But for now, the thing for parents is if you see something abnormal, if your child's complaining of headache or dizziness or just not acting right, isn't playing up to par, or maybe is emotional, you pull them out of the game, you watch them, don't put them back in the game, and then keep them away from school and technology, and then get them evaluated by their doctor.
No pat on the butt, get back out there.
No, not anymore. There's no such thing as having a ding or getting your bell rung anymore. We don't use those terms. Those are no-nos.
Totally different train of thought here the last few years with concussions in sports. All right, well, guys, appreciate you taking time to, like I said, I mean, a lot of people maybe don't even, realize some of that going on behind the scenes. When we talk about Johns Hopkins and All Children's Hospital, maybe thinking it's the big illnesses that you hear about and the stories that, we're talking about. But that's fascinating.
If I could say one more thing,
Absolutely.
I want to thank the listeners, all the listeners that support this hospital. You don't realize when you walk through this hospital every day and you see families just like yours who now have a medical problem and they need us. And for those listeners out there, we're all so lucky that Johns Hopkins All Children's is here. For me and my 3 children, knowing that we're here in Pinellas County and knowing that we serve the bigger area with this first-class care that is rivaled, there's not many places across the country that offer the type of care and the specialized care with the specialists that you hear on this Radiothon. And I just want to thank the listeners for going ahead and making a donation and helping us further our mission to move things forward, not just for the kids of Western Florida, but for the whole world.
Absolutely. Well, appreciate you both. Appreciate your work. And go Google him right now, Dr. Dr. Patrick. See maybe a new picture from today. All right. Dr. Patrick, Dr. Jennifer, sports medicine program here, and Dr. Jennifer with pediatric neuropsychology. As he was mentioning, got to make these phones ring. 1-800-270-8642.